Astrophobia is a specific type of phobia characterized by a great fear of thunder and lightning. People with astrophobia may feel very overwhelmed, anxious, or may experience panic attacks during thunderstorms, or even when anticipating stormy weather. This fear can be triggered by the loud sounds of thunder, the sudden flashes of lightning, or past traumatic events related to storms. Astrophobia can lead to avoidance behaviors such as seeking shelter inside, being away from windows during storms, or constantly checking the weather forecast to prepare for potential thunderstorms. The fear of thunder and lightning can significantly impact a person's daily life, causing distress and disrupting normal tasks during stormy conditions. Hemophobia is a specific type of phobia characterized by an irrational and great fear of blood. Individuals with hemophobia may experience intense anxiety, nausea, or fainting at the sight of blood, whether it's their own blood, somebody else's blood, or even in medical places such as hospitals or doctors' offices. This fear can be triggered by seeing injuries, undergoing medical procedures that involve blood, or even by seeing blood in media or real life. Hemophobia can lead to avoidance of situations where blood may be present, avoidance of medical care, and can interfere with necessary medical treatments or procedures. Managing hemophobia often involves therapy techniques such as exposure therapy and cognitive behavioral strategies to address and lessen the fear response. Cynophobia is a specific type of phobia characterized by an irrational fear of dogs. People with cynophobia may experience intense anxiety or panic attacks when around dogs, or even when thinking about encountering dogs. This fear can develop from past negative experiences with dogs, such as being bitten or chased, or it may come from cultural or environmental factors. Cynophobia can lead to avoiding parks, neighborhoods that have dogs, or public spaces where dogs are allowed, impacting social interactions and daily tasks. Treatment for cynophobia may involve gradual exposure to dogs in controlled settings, therapy to challenge negative beliefs about dogs, and relaxation tactics to manage anxiety symptoms. Claustrophobia is a specific type of phobia characterized by a fear of tight spaces. Individuals with claustrophobia may experience severe anxiety, panic attacks, or feelings of being stuck when in enclosed spaces such as elevators, crowded rooms, tunnels, or small places with limited exits. This fear often comes from a sense of losing control or being unable to escape, triggering physical symptoms such as sweating, fast heartbeat, and shortness of breath. Claustrophobia can significantly impact a person's life, causing them to stay away from places that trigger their fear, which may interfere with work, social activities, or medical treatments. Some treatments could be therapy or being put in those tight places more often, so that the person can learn to control it over time. Glossophobia, also known as speech anxiety or fear of public speaking, is a specific type of phobia characterized by an intense fear of speaking in front of an audience. Individuals with glossophobia may experience symptoms such as trembling, sweating, rapid heartbeat, dry mouth, and difficulty thinking when faced with public speaking situations. This fear can stem from concerns about being judged, criticized, or embarrassed in front of others, and it can really impact academic, professional, or social opportunities that involve public speaking. A treatment for glossophobia can be gradually being exposed to public speaking situations so that you can build more courage to speak publicly. Aerophobia, also known as aviatophobia or fear of flying, is a specific type of phobia characterized by great fear or anxiety related to air travel. People who have aerophobia may experience extreme anxiety or avoidance behaviors when boarding airplanes, or even when thinking about flying. This fear can be triggered by various factors such as fear of crashes, turbulence, feeling out of control in the air, or being restricted in a small space for long periods during flights. Aerophobia can significantly impact a person's ability to travel for work or leisure, leading to avoidance of air travel and missed opportunities. Treatment for aerophobia may involve cognitive behavioral therapy, or CBT, exposure therapy to gradually desensitize to flying-related triggers,